everybody to the podcast. We have a special type of podcast. We're also going live on Instagram, so if you're watching on Instagram, you won't be able to hear Coca-Cola Machine. He'll be joining on in a few minutes. But if you're watching live on Instagram, don't know what this is, and you don't know why Z's World Live, we are doing a very special COVID-19 podcast. It will be everything you need to know for the virus. So this video will be going on YouTube later. So just in a few minutes, Coca-Cola Machine will be joining on Xbox. You guys on Instagram won't be able to hear him, but if you're watching this on the YouTube channel, you will be able to hear him, hopefully, if he includes his audio. So let's just get right into it. So right now we are under a pandemic right now. Coronavirus COVID-19 is just bombarding this planet right now. The world is in crisis. We've never seen anything like this ever. We are so reliant on technology right now, and we are all being forced to quarantine. It's just changing our lives every single day. So I'm going to start off just going through what this virus is, what the symptoms are, what you need to do to prepare, how you can prepare for this, and answer any questions that you guys have. Thankfully, we got a list of questions. So if you are watching this and you didn't get a chance to ask a question earlier, now is a good time to put it in the comments below. If you have anything on YouTube as well, if you're watching this, put it in the comments on YouTube as well, and we will be sure to answer right away. So give me a second, just fixing something on Instagram. All right, cool. So coronavirus, we're just going to go over the symptoms right now. The main symptoms of this virus include fever, cough, and shortness of breath. Yes, this sounds very similar to other illnesses as well, just like the flu, the common cold, and allergies. But if you're watching this on YouTube, you should be able to see a little picture right now. But obviously, if you're on Instagram, you don't see it right now. But really going over this image right here, it's just comparing the lists of each illness, COVID-19, common cold, and the flu. And it's just saying which one of these are mild, which one of these are rare, and which one of these are common in these diseases. Now, the main differences, I'm going to go through COVID-19 really quick. So fever, dry cough, and shortness of breath are all common. They are all common symptoms with this virus. Headaches, aches and pains, sore throat, and fatigue have been reported with these viruses, but are not seen regularly with these viruses. It's only very different types of cases you'll get these symptoms as well. We go on to diarrhea and runny nose. They have also been reported in some cases, although it is very rare to see these with COVID-19. Sneezing is not a symptom of this virus. So if you are sneezing, you probably don't have coronavirus. Now, it's important to remind you guys as well as we're going throughout this whole episode. I myself am not a healthcare expert, nor is Coca-Cola Machine. This is just the facts that we got online. And these are reliable sources as well, from top news sites, the CDC, World Health Organization, ABC News, CNN, Fox News. None of those Telegraph UK stuff. But anyways, those are the main symptoms of COVID-19. So how does this compare to other diseases as well? Well, we're going to go through the common cold really quick. So you don't really get a fever with the common cold. It's very rare you do. You get a dry cough. It's mild usually. With the common cold, no shortness of breath, just like the coronavirus. Coronavirus is shortness of breath. Cold doesn't. Neither does the flu or allergies. Headaches are rare with the cold. Flu are common with headaches. The main differences between these viruses is if you have a fever, a dry cough, and shortness of breath altogether, you most likely have this virus. Excuse me. How does virus spread? So it is not airborne, okay? Airborne means it attracts the particles in the air, and you can easily breathe in through the air, okay? What this does is it is person-to-person contact. So if I shake hands with somebody, if I'm infected and I shake hands with somebody, that person becomes infected. That's one of the reasons. Respiratory droplets when someone coughs or sneezes. So it spreads kind of like the flu or the cold. You sneeze, all those particles, saliva particles from your mouth go into the air and you suck it all in, and that's how you become contagious with the disease. It can spread from contaminated surfaces. So a big recommendation by the World Health Organization, excuse me, the big recommendation by the World Health Organization is that we sanitize everything, sanitize commonly used surfaces. For instance, you see my desk right here. I have been wiping this down once a day, every day. In the workplace that I work at, we work in childcare. We have this desk where everyone uses. We had to sanitize that every 30 minutes before work shut down. So the spread, it is also important to remember as well that just because you don't show symptoms doesn't mean that you don't necessarily have the virus, right? This virus is known to take at least 7 to 14 days to actually show symptoms. So I could go into contact with somebody today. I could go and shake someone's hand today, and they might be infected. And I might be infected immediately with that virus, but it doesn't mean I go home that night and I start coughing and I start having this fever and shortness of breath. That's not going to happen within 24 hours. All right. What's going to happen is it's going to take about 7 to 14 days, maybe even less, for this virus to appear, which is why you see all these healthcare professionals freaking out that we're not spreading the infection rate close enough or slow enough, because within 2 weeks from now, that's why they say this is going to get worse, because so many people are just being infected right now, and it's just going to keep on going from there. So that's how it spreads, just so you guys know that. The people that are most at risk with this disease. So we're also going to debunk some myths here with this as well. Ages 65 and up, people with respiratory diseases, heart conditions, people at any age who are obese, and people who are pregnant as well. And there are many other symptoms or risks as well, or underlying health conditions, whatever you want to call it. There's a whole list of those underlying health conditions that you can go find on cdc.gov or the World Health Organization. And those are the people most at risk. Now, this doesn't mean that these people can only get this virus. That's not the case. So, from what I read earlier today, and this may have changed, and this is also important, I forgot to state this at the beginning of the podcast, which is very crucial. All of these statistics that I'm getting on this podcast are as of March 31st at around midnight. Okay, so obviously this will go up on YouTube channel maybe a day or two later, and the statistics have changed. Maybe you might be watching this a week from now. The statistics will be changed by the time this shows. Anyways, back to the people at the most risk. That doesn't mean that those people necessarily get this virus. What this means is that these people, if they get this virus, they are probably have the most fatality rate out of anybody else. Now, that also doesn't mean that, for instance, I'm 21 years old. I read a stat the other day that in New York City, New York State, 54% of the people infected in New York State are between the ages of 19 and I want to say 49. 54% of people infected in New York State. That's a lot. So that doesn't, just keep in mind, and I know I'm repeating myself here as well. People most at risk, that doesn't mean that these people only get this disease. This disease does not discriminate your age. It doesn't discriminate your color, your skin, your political views. This disease can infect anybody. Originally, we thought this disease doesn't infect children. That has been proven wrong. Children are being infected. And it's a scary situation, and people are, they're just taking this way too lightly, right? I know it's not the most deadly disease that we've ever had or faced as a human race, but this is a disease that's serious. It will kill people. We don't have a cure for it. It's a very new disease, so we're still finding out new information about this. Going to the myths now. So these myths have all been proven by health professionals and scientists to be debunked. So originally it was said that men with beards are more likely to be infected. That is not true, okay? For instance, I have a beard. The original theory was that if someone coughs, this virus will attract to someone's beard and it will stick there for days, even weeks, because beards are dirty. Okay, they are dirty. Excuse me. That has been debunked. That's not the case. If you have a beard, you're fine. Keep growing that beard. Uh, Dogs cannot get this strain of coronavirus. Okay, that is true. Okay, I know that. Now let's put this into perspective really quickly. Okay, uh, there are coronavirus strains, not the COVID-19 strain. Other strains that dogs can be infected with. It has been proven, and I found this on the World Health Organization and the CDC, and all these links will be included in the description where I got all these sources from. Dogs cannot get this strain of coronavirus. Now, it is also recommended if you get this virus, you need to stay away from your dog because that dog may not be infected with that disease and get sick, but that disease can also latch onto it as a carrier and it can jump. So let's say my dog comes in here, I have COVID-19, I pet him, that dog is a carrier. He's not infected with the disease. The disease is just latched onto him like a parasite almost, although it's not affecting him internally. Then that dog goes downstairs and my sister pets the dog. Then she can get that virus. This is according to CDC.gov. This is according to the World Health Organization website and many other sources. So if you're sitting here saying that I'm wrong, just go on the link below in the description below, and you can find all that information below. One other myth that we are going to debunk right here, right now. It has been reported that this the source of this virus was known to be in a bat that was cooked in a Chinese soup. That is false, according to the CDC.gov and World Health Organization. Right now, we do not have a exact source that we where this came from. We know that it did come from a market in Wuhan, China. We don't know exactly what the carrier was. The carrier, if you watched any specifically, it's a movie on Netflix, Outbreak. Go watch that movie. The carrier of that virus, which was replicating Ebola, was a monkey from South America. So go. Oh God. Coca-Cola just requested to go live with me. I don't know what I'm doing. So let's see if that works. Hang on. This is on Instagram. Oh man, there he is. What's up? Okay, so are you getting on Xbox or? Okay. Are you able to hook up to the party too, so you can record your audio in there as well? If you're watching this on YouTube, we're just taking a brief pause. Coca-Cola Machine just joined our podcast. Right now, we're talking about myths. We're talking about the exact source of this virus was unknown. We don't currently know where or what this virus came from. Michael, screw you. Manchester's blue. So it has been reported that this had come from a bat. That is false. We don't know where this came from. We know that it came from a market in Wuhan, China. That's all we know. So anyways, moving on to that. Other essentials. So a lot of states, specifically in the U.S., a lot of countries, Italy, England, Spain. I can't list all the countries right now, but they're on lockdown. Okay, I don't believe. Now, don't take my word for this either. I don't believe any states besides New York and California and Washington are on total lockdown in the U.S. So a lot of other states, though, are at a stay-home order. So what is the difference between those? Currently, Coca-Cola Machine and myself are currently on a stay-at-home order unless something changed with him that I don't know about. Everything's still going on down there? Okay. So a stay-at-home. Do you want to explain what a stay-at-home order is? Because you guys have been in that longer than us. We were just given a stay-at-home order like yesterday, and you guys have been in it for like a week or two.
3 weeks.
So Well, I'm gonna wait. Actually, don't answer that question till you get on, till you join the party. Um, Let me actually invite you to that party on Xbox. Did you get that invite?
Yes, sir.
All right, let me know when your audio is included, and then you can answer that question.
It's included.
All right, so answer the question. What exactly is a stay-at-home order?
Alright, so from what I've seen here in Louisiana, we have had it for 3 weeks, 4 weeks on Monday, I think. Well, 4 weeks for me on Monday. Um, from what I know, there's nothing really different compared to, well, states that haven't, like South Dakota. You were where they don't have stay-at-home mandates. All I know that's different is non-essential businesses are closed. Like for us, hairdressers, saloons. Uh, this is a confusing one for us. The mall is closed unless the store has an entrance and an exit from the outsides, so you'd have to go inside the mall. Uh,
That what? Hang on, what?
so no, I.
The All right, I'm listening.
So if you pull up to a mall and you don't have to go inside the mall to get to the store, those stores are open. Does that make sense?
No, it doesn't make sense. Why would? Okay, I mean it does, but it doesn't. It's like it's one of those things where it's like, okay, I see why you're doing it, but it's a dumbass move. Like,
Yeah.
all honesty, that's what it is. Like, anyways, so basically, what you're saying is stay at home is, you can still go out, get essential items, like I have listed here, according to now. Don't This might be different in other states, but in my state, Virginia, we can only go out for food, doctor's appointments, and medical attention. Um, and that is it. Every non-essential business is closed. Every park is closed. For some reason, golf courses are still open. Like that makes sense. But and they're actually enforcing it. So if you're caught, I'm sorry. There's a gap there. They're enforcing the 10-person rule, which means you can't be in a group over 10 people in Virginia. I don't know what this is like in Louisiana. But if you're caught in a group more than 10 people, you can legally be arrested. I believe it's a misdemeanor charge in Virginia. Um, what is it? 10 people in Louisiana, correct?
Yes.
Okay. So okay, going on to the cases and charts. So the charts will only be available to the YouTube version, because it'll be a visual aid and stuff. But right now I'm just gonna talk about the cases worldwide. Um, Give me one second. I don't know what I did with my link. Okay. All right. So we're gonna just list some of the top countries. We're gonna go by country right now. So worldwide, there is a total confirmed as of March. I'm sorry, April 1st. Happy April Fool's Day, by the way. As of April 1st, 12:08 a.m., there is a confirmed 857,487 cases worldwide. So by the time this YouTube video goes up, we're probably going to be at a million worldwide cases. Recovered out of those 860,000 are 178,000. Deaths are 142,107. So still a pretty low mortality rate. Unless you're in a country that doesn't have that essential health care. In the U.S., there's a total of 188,000 cases, probably going to jump over by 190,000 by morning. Recovered patients 700,000 and three or almost 4,000 deaths. In Italy, the United States has the most confirmed cases anywhere in the world right now. Higher than Italy, higher than China, higher than Spain. Italy is the second most right now at 105,000, probably going to be 106,000 by the morning. Recovered are 15,000 out of those 105,000, and Italy has the most deaths anywhere in the world from this virus, and they're at a whopping 12,500 deaths. We're going to go through the last two countries, Spain and China. Spain is 96,000. Total confirmed cases. Recovered cases are 19,000, and deaths are 8,500. China, where this all started, 80,000 total cases right now. I believe the last time I read it, they're on that decline as of April 1st. 76,000 recovered and 3,000 total deaths. Moving on to the U.S., I'm only going to name like one. The primary concern right now is New York and New Jersey. Did you just drop your phone?
Yep.
Okay. I'm actually good. Okay, never mind. All right. So New York right now is being dubbed as the next Italy, and I'll get to that in a second. New York has a total confirmed cases of 75,000 cases out of those 188 cases, or 188,000 cases in the U.S. total. They have right now 1,550 deaths. So, why is that big? I'll tell you why. Let me get my handy dandy cheat sheet out. So, this is all information about New York right here. New York City has been dubbed as the next Italy. Why? So Governor Cuomo, who's the governor of New York State, has stated that states are basically bidding for ventilators right now, like eBay. So there's a shortage of ventilators for people with breathing problems, and we're getting to the point where states are bidding on a stockpile of ventilators like it's a sale on eBay. That's not good. People are going to die. So what is the statistic in New York that's alarming? One person is dying every 6 minutes in New York City. Just put that into perspective for a second. One person is dying every 6 minutes in New York City. This is where we are at right now. It is a very sad situation right now in New York City and other countries like Italy and Spain and England. Our thoughts and prayers are with those people. We need to slow this curve down. The U.S. responding to the crisis in New York City right now, the U.S. Comfort had arrived to help with hospital overflow. And I'm going to remember this podcast, remember this quote I'm about to say. Those pictures that you see of that cruise ship going past that, or not a cruise ship, that naval ship going past the Statue of Liberty into New York City, those pictures are going to be remembered forever. Those pictures are going to be almost as famous as the Titanic pictures. Think of any picture that you can think of in history that is famous. That picture is going to go down in history because this is a huge, huge crisis right now. And then lastly, in world news, President Trump has said today for the U.S. to prepare for a very, very hard next few weeks. So going into that, and this is where that's everything you need to know about this virus right now. Now it's all opinion based right now. And this is why we brought on Coca-Cola Machine. So I will say for Instagram as well, it only limits you to an hour live streams. So I'm going to end the stream here right now and hop back on and finish this part of the stream. So don't go anywhere Instagram. I'll be right back.
Oh.
Hang on. Pay attention to Instagram and click join again.
Alright.
Because it only limits you to an hour session at a time. Good podcast so far, mate.
It's a fantastic podcast so far.
Well, it's about to get heated up in a second because this is where we
I know
debate
it
each
is.
other. Are you not getting a notification that I'm live?
Yeah, I just go.
Okay.
Oh, that's the wrong one.
Hang on, mate. I'm gonna wave at you.
Right. Oh, why is your audio not working on it?
What do you mean?
Can't hear you on Instagram.
You having a piss?
No. Hang on, say something.
Hi.
There you go.
Okay. Wait, hang on. Try now. Can you still hear me on Instagram? Okay, never mind. All right, cool. All right, so we are on part two of this podcast, starting now. So this is where really Coca-Cola machine comes in, so we can discuss this together. Now that we got all the basic information, everything you need to know about this virus, now we're going to talk about what's next. So with this, we have a few questions that were asked to me on Instagram, which I thought were good questions. We're going to get to those in a minute. Right now, I'm going to actually have Coco go first because he is our guest and it is the etiquette thing to do. Let the guest go first. So, what are your thoughts on all this? What are you thinking? What's going on? Tell me everything you need to go off about.
Alright, well, first of all, I would just like to start off by saying yesterday, Louisiana reported 4,025 cases of coronavirus. Now remember that number, 4,025. At 12
And
o'clock,
this is as of March 31st at around, let's say, 6 o'clock.
I would count. That was the 30th. That was
Well,
yesterday.
oh, this is yesterday.
Yeah,
Okay.
yeah. I'm gonna compare. So
Well, okay, yeah.
on the 30th, we had 4,025 cases, and as of 12 o'clock today, our cases rised up to 5,237. Now, I have seen
Wow.
it. Let me just say, I've seen some people say that because we had Mardi Gras a few weeks ago, it was a breeding ground for coronavirus, as they said. Now, I was at quite a few Mardi Gras parades.
Oh, Josh Allen, 1 million likes joined. I just had
Oh,
to point that out. I love that account. Look,
I'll shout out to Josh Allen, 1 million likes. um, Deaths are going even higher. Apparently, these cases are a week behind in Louisiana. It takes what, four days to get cases in, or to test them. Um, and basically, our governor had a conference today. Well, he does one every day. He still says that Louisiana has a very long way to go before we can even start flattening out that curve, which is worrying in a way. Um, he's put out a stay-at-home mandate. I've been in for 3 weeks, almost 4 weeks, and I admit, I do want to say it's extremely boring not to be able to go out and do things that you would do on an everyday. Um, as restaurants goes, takeout, drive-through, curbside pickup. I actually did the curbside pickup on the weekend. It's well done. Um, Basically, I just opened the back of my car and they put the food in there and closed it for me.
yeah.
Um, what I do want to say is, if you are in a state and you're in a stay-at-home mandate, stay at home. Like I said, I know it's boring, but if you do it now, the sooner we can go back to living our real lives. I admit, I play golf. I do it in the evening when it's not busy. I do want to say as well, shout out to my golf course. They've taken all the measures to make sure we're safe. You can't put your
What kind of
hand.
measures are those?
They've taken away all the water coolers, all the ball cleaners, all the trash
Ooh.
cans. They've taken away all the bunker rakes. You can't touch the flags. You can't put your hand in the cup. They put like foam in the cup, so you just reach down like an inch and grab your ball. They have taken all the measures. They've closed down
Wow.
the restaurant. The beer cart lady doesn't come around anymore and serve me beer.
That's a tragedy.
It is a tragedy. But I will say this, and I cannot tell you how much this infuriates me. We're in a stay-at-home mandate. When I'm playing golf, there's 3 houses on that course I go past. Every other day, they're having a party outside. They're not self-distancing like they should be. They're all outside. They drive the golf carts down. They're all together. They're all hugging each other. They're all drinking, arms around each other. And another thing, this is going kind of off, well, a little bit off topic. There's a church in Louisiana, and I don't know if you've heard about this. There's a what do you call those
Is it the
people?
church where they met and like everyone was arrested?
No, no
I
one
thought that
was.
was in Florida.
Yeah, there's one in Florida. There's one in Louisiana
Okay.
where, what do you call them? The pastors, something like that. They there's one here. He actually got arrested today, charged with 6 misdemeanors because every other night, I think it is, he's hosting a, what do you call them? Services,
Okay.
and there's hundreds of people that go there. The governor's told him, the mayor's told him, the police have told him, stop, you want to do it, do a live stream. He did another one tonight at 7 o'clock. Hundreds of people once again turning up. Where's the self-distancing? How stupid can you be where other churches in Louisiana are all doing it on a live stream? Why is this guy?
And it's not just your churches too. There was, and for those of you who don't know what we were talking about, the Florida thing. There was a church in Florida, very similar to what happened over near y'all, where they basically ignored the social distancing costs, and I don't know how many people. It had to be, I think, hundreds of people in that church, and they all got sick. I think the pastor was arrested, and other church officials were arrested for having that service because it broke the law at that time. It's just a mess. Nobody's taken this social distancing serious.
It's absolutely infuriating. We have to suffer because they can't listen to a few orders. Stay inside, don't leave unless you absolutely have to, and we'll be out of here sooner than later.
Yeah.
What
Um.
are you saying?
No, go on.
Another thing I want to say, and this hasn't happened in Louisiana, but it has happened in America. I don't know if you've seen some of the reports. There's people going around in stores, going up to police officers, coughing on them or licking supplies in the stores, and saying they've got coronavirus.
It's. I hate my generation. That's all I'm gonna say. I'm willing to bet $100 that those are all people around our age too.
Yep, very likely.
That sounds like something Logan or Jake Paul would do. Come on, people. Respect to Logan Paul, because I actually have no issue with Logan Paul now. But that sounds something like Jake Paul would do, or who's another cringy YouTuber that I can't stand? David Dobrik or something.
And I'll tell you, I've never washed my hands so many times in one day. But like,
I have a bathroom right next to my room. I'm literally every game of FIFA, I go wash my hands.
I'm telling you, the bad thing is, I'm running out of toilet paper, right? No store around me has toilet paper. I'm in
You gotta go
trouble.
early in the morning. You gotta go like I know you hate getting up early. So my mom, we have I think at least 3 cases of them. We gotta have at least maybe a good supply for the next 3 months, and and we're not being selfish and hoarding these as well. We're like if one of our neighbors needs some, like we'll give them some. But the key was, and this is what my mom said, you got to go right when Walmart or Target open. Like even she said that she was standing in line for 20 minutes before they opened,
Oof, probably
and
can't
they
do
still
that.
had plenty of toilet paper. So that's what time you got to go if you want toilet paper.
Actually, I read an article today which it's sad to hear, but at the same time, I, there was an old lady in Belgium. I think she's 90 years old or something. Uh, she had it, and of course, she went on a ventilator. She told the doctors to take the ventilator off of her and give it to a younger person. And I think it was a day after she passed away.
Oh, jeez.
But
It's so sad. Like you hear all these stories, and like my mom and I were watching World News tonight, and like I forgot what the story was, but like we just sat there choking up because it's no, I remember what it was. It was because I saw it on Facebook too. It was a doctor. I don't know where it was, but it was a doctor who was coming down from the elevator, and when the elevator opened up, his wife and son were there, and his son's like 2 or 3 years old. He doesn't know what's going on. He's 3 years old. What are you gonna tell a 3 year old? There's a there's a deadly plague going around that's killing people right now. You can't tell a 3 year old that. So the 3 year old, the elevator opens up, and the 3 year old, like every other 3 year old, when they see their dad, I hope at least, they run to the elevator, arms open, daddy, and the dad like puts his hands up and tells him to stop, and he can't hug his kid. The kid's sitting there clueless, what's going on, and like the dad just breaks down and starts crying. It was just, it's incredibly sad. It's heartbreaking. Like you, the thought. Look, I don't have kids, right? You don't have kids, hopefully, unless you're hiding something. Um, but but no, for in all seriousness, no. Like if I'm a dad and I can't hug my kid and my kid's sitting right there in front of me, that's gonna kill me, right? This is how serious this is. You don't want this spreading to these kids. You don't want this spreading to other people. If you're sitting in the hospital and you're on your deathbed on a ventilator, you know what they do? They can't bring your family in. They have to FaceTime. The doctor has to ask you for your phone, or they pull out their phone and they get your family's contact information, and your family FaceTimes you and watches you die. Let that sink in for a minute. Is that how you want to go out? If that's not how you want to go out, you need to social distance yourself immediately and take this seriously, because I can't imagine me being on my deathbed and a doctor, somebody who I barely know, is the last person I'll ever have human contact with as I'm dying, holding a phone with my family on it. They're all heartbroken and in tears, and they can't physically touch me like I would be if I was just dying normally of old age. That's sad. Just let that sink in for a moment. But I mean, moving on. I hate to cut you short a little bit, but we gotta answer some questions and talk about some other stuff too. Um, so how can we stop this? Right? Um, Social distancing. It's very, very simple. I'm going to include a link on YouTube, if you're watching this on YouTube, to a social distancing thing by the Washington Post. It's very informational. It's very educational. It shows on a graphic what the effects of social distancing can do. Um, and what there's going to be 2 different curves. And I'm going to go back and record this later. Um, there's two different arcs of one with one big arc, right? It's just one big arc, and on that arc it says the effects on if we don't take social distancing. That's what our arc is going to look like. And then there's another arc that's not as big. It's maybe like going around like halfway. That one is titled. This arc is showing what the curve is going to look like if we do take the social distancing standards. So just, I mean, I know we covered this already, but just any last minute touches from you about social distancing.
Just, we've all got to do it. We're all in this together. We've all got to do it. The sooner we all do it, the sooner we can all get back to our regular lives.
100%, 100%. Like we talked about earlier, this virus, and the reason why these people are saying everything shut down for a few weeks is, and this is a question we're going to answer later. We don't know how long this is going to end. This could last for months. This could last for years. We don't know. And like, I'm not being over dramatic when I say that, but it realistically could. It realistically could. And they're even predicting Dr. Fauci or whatever his name is. What's his name? The dude that is with Trump every day.
Dr. Fauci.
Yeah, Dr. Fauci. He even said the CDC and World Health Organization are clarifying this, that it is very possible for this outbreak to happen again in the fall. So this could all go away by the summer, which is what we're hoping, but it's also possible this could happen in the fall. What's the difference though? In the fall, we're probably going to be more prepared. Hopefully, and I pray to God, we're going to talk about this in a minute too. Hopefully the economy recovers. I can't see it recovering that easily though. I mean, luckily we do have a president in office who is very knowledgeable in that area of economics. So I mean, there's honestly nobody, and I'm going to try not to get political here, but in the U.S., we're in a good situation economics-wise because we have a very knowledgeable person in that field in office from an economic standpoint. So, and I do want to talk about this really quick. So this just, if there's one thing that makes you cringe, this is it for me. People say this all the time. More people die from the flu every year. Yes, that's true to an extent. Let's think about this for a second. This virus was discovered in December. How long has the flu been around?
Yes.
Years. 1900s, 18, hell, early man time. I don't know how long the flu's been. It's been a hell of a lot longer that it's been around since COVID. I can tell you that. We don't have a full statistics on how many people die from this for a year. We've been in this situation and have statistics for 4 months, right? So if you're one of those people that are saying more people die from the flu every year, okay, you're the issue. You're the reason why this is going to keep going and people are losing their jobs. This is the reason why I filed for unemployment the other day, okay? This is the reason why millions of other people are filing for unemployment and are dying and getting sick, can't see their families, are staying bored in the house, whatever, right? And I'm going to sure as hell clip this and post this on Instagram or Facebook because the world needs to hear this too. You are the issue if you're saying that because that's completely BS. We don't have a 4-year statistic of how long this virus has been around. So if you're sitting there saying the flu, more people die from the flu, you're the issue. I don't know if you want to comment on that. I'm getting triggered.
Yeah,
you know
it's
While you say something, I'm gonna look up something just to clarify my. Was that thunder? Never mind.
Speaking about people losing their jobs and all that, I'm friends with someone at a local pizza place. I'm not going to say a name or the restaurant for personal reasons. She is a single mother who is working as a waitress there full time. She's got a daughter, and she's also looking after her grandmother, who has already been in hospital this year because she got third-degree burns. She hardly makes enough money to live with for the start. as you know, waitresses usually work for tips. That's basically their full paycheck. Um, she's hardly bringing in any money now. She's got a daughter to look after. She's got a grandmother who is not in good health. So for anyone that thinks it's the flu, just the flu, and is out there tonight, tomorrow, Thursday, Friday, Saturday, Sunday, and you're ignoring those stay-at-home mandates, even if you are not in a stay-at-home mandate, you shouldn't be going out. Stop the spread now. She's at
And
home. She's worried sick. Almost said a bad word there. Um, she's got a daughter. She's got a sick grandmother to look after. She needs to get back to work as soon as possible. Everyone out there is stopping her from making money. She's got rent to pay. She's got bills to pay. People out there that are not taking this seriously are taking that away, not just from her, but millions of other people around the world that are in the exact same situation.
and let me like I said, I'm gonna, and that's the case for billions of other people. And I say billions because this is a thing around the world. People are unemployed right now because of this virus, because we as a human race are being selfish. We are at a most selfish and vulnerable point where we are not considering others. That's what the problem is of this world today. We don't consider others at all. We consider ourselves. My dad always taught me, feed your horses before yourself. So, like I said, I found exactly what I was looking for. It took me 2 seconds. I just Googled how many people die from the flu every day. I couldn't find that, unfortunately, but this is very helpful as well. And this just proves my point as well. This is from the CDC. And again, I include all this links in the description below. So the question is the coronavirus disease more severe than the flu? So this is their answer. COVID-19 causes more severe disease than the seasonal influenza. While many people globally have built up immunity to the seasonal flu strains, COVID-19 is a new virus to which nobody has immunity. That means more people are susceptible to infection, and some will suffer severe disease. Globally, about 3.4% of reported COVID-19 cases have died. So 3.4% mortality rate. By comparison, seasonal flu generally kills far fewer than 1% of those infected. So what does that mean? That means, let's put it this way. Have you gotten the flu before ever in your life?
Yep, many times.
Have you gotten the flu shot before?
Not in a very long time.
Okay, so let's put this into perspective. Okay, disregarding last year because you don't know for sure yet, but to your known ability, have you had coronavirus before?
I don't want
Remember what I
to.
said? Don't, because you don't know that for sure. You don't know that for sure if you had it last December. Exclude that because you don't know. I'm talking that you have went to a doctor and the doctor said you have coronavirus. Has that ever happened to you?
No.
Okay. Have you ever had a coronavirus vaccine?
No.
Okay. The last question, there is no vaccine. There's no vaccine for this. So if you're sitting, there's a vaccine for flu. Okay, that's why people don't take flu as serious as COVID right now. Because there's an actual vaccine for it. There's no vaccine for this. Moving on because we are running out of time. Why is all this bad? Okay, cool. So, from an economic standpoint, and I've been saying this for months, and so is my economics teacher, and as a student in economics as well. This virus is probably going to be more of a health or an economics virus than a health virus. That doesn't mean disregard it as a health virus. This is a very serious health virus. I'm saying no, I think it's going to have a more bigger impact economically than it is health wise because, like we talked about, billions of people are unemployed, businesses are shutting down, the stock market is going to bear market for the first time ever, I believe. We had the worst quarter ever in Wall Street history yesterday. This is all stacking up to show that this is an economic virus as well. This virus is causing problems economically. This is going to put hundreds of countries back. And this is what I want to cover about the economics part. To answer, so we have 5 questions, right, that were asked to us by fans. I'm not going to say these fans' whole usernames. I'm just going to say part of their usernames. So, first question was from Claire. How worried should I be? Do you want to go? Do you want to answer that first?
Yeah, I'll go ahead. So as we know that this virus can affect anybody, it doesn't matter what age, what race, what gender, it affects anybody. Um, of course, you have more chance of dying if you are older or if you have medical conditions. But it can affect, you can have no symptoms at all, you can have it all. Probably the worst part about it would be that it makes you struggle to breathe. Would I say worried? I wouldn't say more worried, just if you wash your hands every day, stay inside, only leave when you absolutely have to, you should be fine.
I say only be worried if you're in a country that is less fortunate, that doesn't have as good as healthcare as as good as healthcare as other countries. That's one reason you may need to be worried. It all depends on your circumstances too. Any one of those underlying health conditions, yes, you need to be worried because you don't want to attract this because you might have a more higher fatality rate. And then also if you lost your job like I did, if you were furloughed, because you're not making money. So how are you going to support your family? I'm in a very lucky situation where I don't have a lot of my own responsibilities. I'm a college student. I still live with my mom. So luckily, and God bless her, she works from home, so she still manages to work online. So we're in a fine situation right now here, but other people aren't as in a great situation as per se us. So to answer your question, Claire, it all depends on your situation. Underlying health conditions, countries. I'm going blank. Holy crap. Healthcare system. Godly. Okay. Moving on to the next question. So this one was asked by Claire again. Best way to prevent COVID-19 on packages, which I thought was a very good question. So I actually asked a friend when I saw this who is in the field, and they said they believe, now don't take this for granted because Amazon states this, but this isn't always the case. Amazon, eBay, whatever you get your online shipping from. They state that they do sanitize regularly those packages to make sure that their employees aren't sticking all that crap on there. But what I recommend personally is if you have a package at your door, get some viral disinfectant you can pick up at Walmart, Target, anywhere. Give that sucker a good rub down, and then maybe let it sit for an hour or two. Get some gloves, just kind of leave it on your porch a little bit, or maybe you can take it inside. I don't recommend it. But I did not find any specific answer on it because I did research on it too. I didn't see any CDC guidelines on what to do with that. So that all depends on your terms. I don't know if you want to add anything to that, mate.
Like I said, just clean it when it gets there. You know, if you want to take it inside, don't touch it with your bare hands, gloves, hell, even paper towels, bring it in, wash it down, wash the counter down that you put it down, put the box on. I do know the guy that delivers my mail, he doesn't wear gloves. He just touches it with his bare hands.
I can hear the disappointment in your voice when you say that.
Yeah. I've got to go out to that mailbox every day and touch the letter. What if he does have it?
All right, moving on. So we've technically already answered this question, but we're going to answer it again. Grape asks, how long is this going to last? We don't know.
Yeah, we
We
don't
don't
know.
know. It could be weeks. We could the curve could slow down tomorrow. The curve could slow down in months. It could slow down by Easter. It could slow down by Christmas. We might be stuck in this for years. We don't know. That all depends on social distancing and what we can do as a human kind. Um, do you want to add anything to that?
Uh, Nothing much really. Say this does go away in the summertime. It's I'm not saying it's certain. It's almost certain a second wave will come in the fall winter time, and we're gonna go all through it again. Hopefully, we're better prepared. But to be honest, I think this. I think this will be with us for life. I think it's gonna be kind of like the flu.
That wasn't a dry cough. I just swallowed the wrong way. I don't have coronavirus. Don't. Okay.
But I think this is gonna stick around for quite some time.
Okay, never mind. I have coronavirus. Holy crap.
Oh, right.
Okay.
Swab up the nose.
So this one I thought was weird. And I'm not going to explain the situation because I do know the situation, but I'm not going to because I don't have this person's permission. Oh, Lord. Ken, you're in the podcast. So we have a surprise guest. Ken's in the podcast with us. Okay, anyways. So the question is, what's up, Ken?
Say hi to the podcast.
Ken,
Well,
you're on the
hello there.
podcast. We're in the middle of the podcast.
Hello
right now.
there.
We're actually almost done, but
Okay.
if you want to make sure you include your audio, if you want to be
Oh, I did.
on the YouTube one.
I already included
Cool.
my
Okay,
audio.
so little surprise, and if you're on Instagram, you obviously can't hear Ken, but on YouTube, this is Ken, and he is a good friend of Coco and I's. He live streams PUBG with us. He just started recently live stream PUBG with us recently. Really cool guy. Ken, you want to drop any YouTube or Twitch info while you're here?
Well, my Twitch is KenMMO with an underscore. KenMMO, no underscore. Underscore's my Twitter. My bad. The MMOs are capital. The Ken is all lowercase.
Is that it?
Yep, that's it.
Okay, that's it.
That's it.
Okay.
Twitch.tv/Coca-Cola Machine 1. The capital
Okay,
C
and-
at the beginning.
Okay,
Oh my-
I don't know how much longer we got on Instagram, so we're just gonna roll through these last two questions, and I believe that's it. Yeah. Okay.
All right.
So, question number 4. Like I said, I know the situation, but I'm not gonna explain it. It's a weird question. Why are some states refusing to test children unless they're already admitted? So, and this was asked by Little. I don't have a exact answer for you on that. Like I said in the beginning of the podcast, I am not a healthcare professional. I am not a doctor. I'm not a nurse. Neither is Coca-Cola Machine. Are you a doctor or a nurse? Okay.
Yes.
Okay, he is. No, he's not. No, he's not. Okay. Anyways, so my best guess is, I believe that some states, such as New York, California, Washington State, Illinois, any state that in Louisiana, even any state you can think of right now that is just in deep crap right now. I know that they are refusing they're refusing some patients, and I don't think I answered this. I may have accidentally skipped over this, but this is actually very crucial. I don't know why I skipped over that. I must have missed that. What to do if you think you have COVID-19? So, according to the CDC and World Health Organization, if you think you have it, you have to call your healthcare provider immediately. Self-isolate from your family, go in another room, call your healthcare provider, and they will give you all the information. It's different by states on what the scenarios are, so you have to go to your state government website to look for that. I know in Virginia, it's call your healthcare professional. Then they try to get you tested. They give you instructions of where to go and stuff. So going back to the question though, the best answer I can give for you is I know that some hospitals are refusing care from people if they aren't critical because of the overwhelming amount. They're trying to reserve ventilators and stuff. So if your kid or you're in general are literally sitting on the floor, like sucking air because you can't breathe, then that's a big issue. That's probably you're gonna be admitted there. But if you're at home and you're breathing okay still, and you're just have a mild fever or something, little cough, you're probably gonna be fine. I don't know if you want to add to that, mate.
I will say, like here in Louisiana, we have started. Well, we've been doing it for a few weeks. It's drive-through testing. Again, you need to go see your healthcare provider to actually get a note to go there. But
If I may give some insight on keeping your hands clean in general, I learned this when you're working in the food industry. People who work in the food industry know that a chef's hands are just as clean as a doctor's.
Mm-hmm.
So, best thing to do if you're gonna clean your hands, use hot water. Rinse with hot water first before you add soap. Soap up, lather for about 20 seconds, rinse, and then dry your hands. And then I recommend sanitizing. That is the best way to keep your hands clean from getting sick.
Do you know where I learned the proper way to wash hands? Dr. Oz.
it's not gonna work.
He said in medical school they teach you to like do something like that. You gotta get your fingers. If you're on Instagram, you can see this. YouTube. I sound like a muppet right now, but on Instagram, you gotta do that with your hands and stuff. Get in there good.
Oh.
Get the top of your hands. Yeah. Anyways, going to this last question because I think this one will be a tad longer. And I think this is a good question too. And this is for Americans too. Moon said, "I love this." Especially, she's saying, "I love this." That when she found out that we're doing the podcast, I love this, especially with me working in healthcare. Do you feel the U.S. dropped the ball on this? I'm gonna let you answer that first.
Well, wait, what? Sorry, what's the question?
How do you think the U.S. is responding to this? How do you think
Oh,
our
okay.
government has done responding to this? I know you have dual citizenship, correct? So people who don't know, he was born in
Yes.
England, and he recently became a U.S. citizen. And what, the last year, correct?
Yep.
So big round of applause for him. So let's compare England to here for a second. What do you think the difference is between England and the U.S.? How they're taking care of it?
To be honest, I haven't fully paid attention to how England's doing it. I know they get thousands of cases a day, just like we do here. I think I will say I think America is doing a better job at handling it than England, just because I don't think England technically have everything to actually try and fight this and get control of it.
Mm-hmm.
I mean, they will eventually get control of it, but I think America is much better prepared.
So I was looking at a chart today, comparing us to other countries and stuff. So our curve, so it's usually like maybe once the first person is infected by like day 15 in a country, that's when the spike goes up. Our spike lasted longer. Our spike lasted like a month and then spiked up. And that is because of the restrictions that we put on travel bans and stuff. Now, I think that we've handled this somewhat well. Some states are handling it better than others. I personally believe, and I know this is a last resort, and I know this isn't what everybody wants, but if we really want to get over this quickly, I think the country needs to go into lockdown. I know that people are going to not be able to go into work. I realize it's going to happen. I don't think we're going to do that, but I think that's probably, if we want to get through this quickly, that's probably the best scenario for us to happen, to do that. And I know that's really hard to say because a lot of people will lose jobs and stuff. But if we want to go back to our everyday life, That's probably the best case scenario. But regarding how we brought it in, it's not impossible to stop because it's a highly infectious disease, and you have a lot of dumb young Americans like myself who want to go travel and stuff and go abroad. And you got Carol Baskin over there on the other side, wherever it was.
Carol Baskin.
Benjamin's Carol Baskin.
That's an inside joke. Okay. Anyways, Moon, I hope that answers your question. We are unfortunately out of time. This is a 65-minute podcast. I've been chatting up a while. Do you have any closing statements before we get off or sign off?
I do. I'm going to try and do a quote here that our governor always says. I'm probably not going to completely say it right. We still have a long way to go, but we will get through this. We will get to the other side. We will flatten that curve down, but we all, and when I say all, I mean every single American in America, we'll all eventually get through this, but we all have to take part. We all have to stay inside. Only leave the house when you must. If you got to go to the grocery store, if you got to go see a doctor, if you got to go pick up prescriptions from a pharmacy. That's the only time you should be leaving that house. Unless you also want to get some exercise, which our governor said was alright, we can do. But we will eventually get through this. We will eventually flatten out the curve. We just all have to play a part in it.
100% right. I mean, now it's up to us. How are we going to respond to this? Are we going to come together as not just a nation, but as mankind and get through this, practice social distancing, and this will at least slow the spread? It's up to us. I don't know how long this is going to last, but if we really want this to be short and go back to normal lives, we got to practice social distancing. That's it. That's all I got to say. I hope everybody stays safe out there. Wash your hands. I pray for everybody every day, everybody watching this, everybody in the world. Hug your loved ones close. Keep them close.
Not too close if you're not feeling well.
If they're sick, stay the hell away from them. But
jab them with a pole if you have to.
I'm not gonna lie, Coco. I thought you had a bird on your shoulder there for a second.
It is. It's a duck.
Oh no! I thought it was like a real life bird. Oh my god. Okay. All right. You know what? We're goofing off now. We gotta go get some chicken dinner tonight on PUBG. Don't forget to subscribe or follow. Yeah, don't forget to subscribe first of all. Then once you subscribe, go follow Z's World 27 on Twitch. That's number 1 priority. Number 2 priority, go follow Ken on Twitch. Link will be in the description. And then lastly, but least importantly, go follow Coca-Cola Machine on Twitch, wherever his name is. Okay. All right. That's all.
Damn.
That is
Go
all
Tigers.
we got for this podcast. If you're watching Instagram, this will hopefully be up tomorrow, if not sometime this week. Coco, thank you for joining. It's always great to have you on the podcast and stuff. You and your duck.
Hey!
We gotta go get some chicken dinner. So I hope everybody stays safe, stay healthy. Godspeed. Z's World and Coca-Cola Machine and Ken signing out.
Go Tigers.